Hey everybody, welcome back. Nathan Romas with you, and I guess we can say welcome back because it's the second episode between the Quiet Professional and the Edmonton Police Service. So thank you for joining us. So we're going to start really broad. You're going to see in our discussion here, it's going to be kind of a macro and some micro size things, but we're going to start very broad and talk just based on your bios. It seems there's a very clear consensus that it must be a joint effort to establish safe transit zones. So why are issues of crime and disorder on transit so prevalent? And in answering that, what sort of changes are we seeing in our cities? Are Edmonton challenges unique, or is it the same across the board? So I'm going to start with you, David, and maybe you could talk about why things are so prevalent in these specific zones.
So there's a number of different factors at play right now. We've had a lot of challenges since the pandemic. We've had an affordability crisis, a housing crisis, a public safety crisis. And one of the things that transit had was we were one of the few public spaces that remained open. And when we had all these shifting societal variables and things going on in our cities, the complexity of what transit agencies have been trying to work towards from a safe space has been a lot more complicated. One of the things that has been a challenge for transit agencies is that transit is typically a safe space, and what we've seen is that people have come to potentially shelter in place in transit in lack of other housing opportunities. We've had people who prey on vulnerability in those spaces, very unfortunately, because they're a wide open public and safe space. One of the other things that's occurred is that when people take transit, what you think about is like, how much does it cost, or is it convenient, or how do you get around? And the question that's now coming into people's minds is it safe? And the reason why they're saying that is when they came back to transit, they're seeing a very different environment. We've had a lot of differing stories in the media about transit. We've had a lot of different political discussions when it comes about transit. And we've seen changes in the environment, and what agencies are trying to work on is just very different subject matter components, very different kind of challenges, and it's something it's not unique to Edmonton. We're seeing it all across North America.
Maybe you want to jump in a little bit too there.
Yeah, definitely want to echo, the societal changes that took place pre-COVID. The Edmonton Police Service, we did have what were called LRT beats. We had small numbers that actually would patrol mainly the LRT platforms, not as much on transit centers, but we did do that. But during COVID and post-COVID, with the, frankly, the defunding movement, and there was also with these vulnerable people that had severe, whether it's medical and mental health, drug addictions, is that it was a lot of the pressure is that we were, victimizing these vulnerable people when they were exhibiting or conducting illegal behavior on those platforms. So there became there was a situation and an overview where police really weren't wanted on those platforms in those spaces. That whether it was non-police, non-enforcement outreach, social workers, medical assistants would be the primary responders to those incidents. And what's happened over time is that the public feedback that we've been receiving and as well as the number of people that have coming back on transit, the focus now is more on visibility of police. Again, dealing with those illegal behaviors, but dealing with them in a compassionate manner and ensuring that we do have the partners and other agencies that we work with in order to get these humans the help that they need.
So maybe quickly too, I'll say, I guess it sounds like there's like a difficulty dealing with the narratives on that as well. And from my own experience working in some of those spaces, I found that we had the overwhelming majority of interactions were very positive between police and people who needed all kinds of services, and then even the public who was just trying to get through those areas. But what do you think we could do or have done that has changed that narrative? So like maybe on the back end, we see some of the different resources coming into play. I guess it kind of falls within your branch. So what are some of the things that we've changed since then?
Yeah, when the previous chief arrived here 6 years ago, part of it was, Chief McPhee at the time talked a lot about off-ramping. We can't jail ourselves out of this situation. We can't just put everybody into custody. So a lot of times it what he developed, though, was a community safety well-being bureau, and many agencies, across North America have implemented something similar based on Chief McPhee's initial implementation of that bureau. But what it is working with our partners. We do have our HELP unit, which is a human-centered engagement partnership, where we work with a number of, where they are funded externally, where there are a number of agencies, including, the Bentero Society, the George Spady, Hope, Radius Health, where they're actually partnered up with a police officer, where they do have caseloads, where they work with the vulnerable individuals. It's very important that, I see a lot of similarities between encampments to the open-air drug use, to the safety issues we see on transit, because a lot of times we're dealing with almost the same individuals all the time. But it's really important to stress every individual has specific needs and has unique needs in order to have assistance. Because if they're not conducting if they're not doing something criminal, is that yes, you are technically in a space where you may or may not be allowed to loiter, but we cannot compel, in a lot of cases, unless a person is under arrest, we cannot compel them to go get assistance. We're not there yet. Maybe someday we will get there, but right now we're not. So it takes many contacts between a navigator and a police officer, many contacts with one individual to get them to that stage where they are willing to go get assistance. And we've really implemented an excellent process and structure to get people assistance.
Yeah, and maybe we'll bring it to even closer to home. Speaking about the city specifically, what are you seeing from the city of Edmonton side in the response that you're giving to some of the challenges that we have?
So I think we've seen a couple things happen over the last 5 years, and I'm glad to hear that. Not glad, I should say, but you always worry that it's something that you've done as a city in terms of how you've managed an issue. So hearing that this is an issue in every other major city, perhaps in North America, I think expands our toolbox, so to speak. But I think, for a few years, and I've been with this issue through the whole thing.
Because this is your second term.
Yeah. So
you've seen it from before COVID to now.
Exactly. I think part of the issue for us has been getting the right response to the right issue with the limited tools municipalities have, cities have, not just in the province of Alberta, but across Canada. But in Alberta specifically, we don't have health authorities. So how do we allocate resources? How do we advocate for the resources we don't have the power to allocate? And then, we can. I appreciate the superintendent brought up the issue around the defund movement. And we can come back to that. But I also think, from a governance perspective, we're always. Every time someone comes to us with a problem, they're also coming to us with a bill. So it's trying to figure out, is this an issue that we literally need more police officers to address, or are there other tools we can use that might cost a little less and get us off this? Sometimes it feels like a carousel, and and it's really frustrating. I think it's frustrating for decision makers. I think it's frustrating for frontline officers. I think it's frustrating for the frontline workers on the system, and arguably very frustrating for the people who do need assistance and feel that they're being pushed off of out of public spaces when there's nowhere else to go.
So who should be operating in these spaces, in these zones? That's, I guess, kind of the big question that keeps coming up. Who should actually be down there? Does anyone want to start on that?
Since everyone's looking at me.
I wasn't looking directly, I'll say that.
I think Sarah brought up a really good point. One thing that I get asked all the time is you're an urban planner. Why are you in this conversation? I say to my colleagues, and this is more within my own wheelhouse of my colleagues, and I say it's a roles, responsibilities, and governance conversation. At the end of the day, we're forming new relationships with evolving, changing variables. We have different skill sets that we actually need. And we need to build the case for investment when it comes to those off-ramps, right? So I'll give you an example. Like one of the biggest universal things I've seen all across North America is that agencies with their partners from a public health perspective or a policing perspective or a community social services perspective, a lot of agencies have flooded the system with frontline staff. They flooded the systems with creating outreach programs and outreach workers to deal with acute issues that you may have, be it some access to healthcare or access to a shelter bed or things like that. We've seen new police partnerships. We've seen X, Y, and Z. But at the end of the day, like one comment I've heard, and I've also spoken to many people who shelter in place on transit or have consumed a substance on transit, and they're told like you need to go somewhere else, right? And it's kind of the line that I've heard a lot where it's like, okay, I can deal with your acute issue right now, but if we don't have the public health infrastructure from, let's say, supervised consumption sites or a pathway to recovery or mental health supports or access to transitional housing or low barrier housing, you just end up moving the person around the system.
So something that Keith said that kind of sticks out in what you're saying is that, and like I would say something I reflect on, like during the pandemic here in Edmonton, we didn't have shelters for people to, like we just didn't have capacity and we need to create a public space. So we opened our convention center to become a shelter. I bring this up because you've sort of made the parallel that the encampment issue and transit issue, oftentimes you're dealing with the same people. But one of, like, reflecting back, I'm going to call it a mistake because I think we're still trying to grapple with the outcomes of that. But I think there was a sense that we could pile 400, 500, 600 people into one space and that all those people needed the same thing. And Keith said every individual needs something different. I'm wondering, and this is maybe too tricky of a question for both of you, but how do we as, like government does things at scale. Government doesn't solve one person's problem. It solves 100,000 people's problems. And these are hyper individual issues in terms of what people need. So have you seen a model where you've been you've seen that sort of tailored approach to individual needs, like either in policing or in public health, social work?
Well, kind of echo what Dave said earlier in regards to gaps in services. When we're dealing with these issues, there's three things. You want to address the behavior. Number two is, reduce crime and disorder. But number three is identify gaps in service. And I don't want to keep paralleling to the encampment work because it's very similar in the fact that we've identified lots of gaps in services. We do know that some of the social agencies in town, we have a tremendous shortage of day space. In the city for the vulnerable people to go to, because the shelters are run by the government of Alberta. They're regulated by the government of Alberta, and every morning they are emptied in order to clean and prepare for breakfast. And where do these people go? And some of the other social agencies, as they've determined that they would have better outcomes, and maybe it's another podcast in the future, yeah. But they stated they use the term den model. I was just at a tour of a facility last week where people can access those services as long as they're belonging to a specific program within there, that they've done the intake. They've gone through a nice, robust assessment, and they're able to get into a program, which is awesome. That's an excellent, great success. But what about the people that aren't there yet? And what about the people that do not want services?
So there's three things I'm going to jump on, but I'm going to illustrate with a story I'll never forget. So the first part is, and Sarah did lean into this a bit, is that there is low voluntary uptake in offered support services. And the reason why is because government needs to scale them, right? Like, it's very hard to have bespoke services to someone's complex individual needs, and that's where we're at. Like, we've had programs I'm seeing being formulated between police services and health authorities where, sometimes the term is called high system users, and you will try to find a way to do that continuity of care and assessment plan and try to sort it out, but it's very time intensive and very complex. One of the biggest things, so in the US report that's going to come out very shortly on the impact of substance use on transit, we went to 5 major cities across the US, and there was this one situation, this interview I'll never forget, that really speaks to what this challenge. The first part is that the question we ask is we interview everyone saying, from operations, law enforcement, outreach, what are you seeing in terms of this topic area? Then we went out with outreach workers for a night and the police for a second night to see the two different approaches. And we were interviewing a large police service in the States. And the question we asked is, how do you keep track of the support services that you can offer to somebody? And there was myself and my colleague on one side of the table, and there was 9 police officers from this community engagement unit on the other side, which is, as a non-police officer, kind of interesting to kind of watch in that kind of dynamic. And there was silence, pure silence. And I also teach on the side, university courses in planning. So this came out of me at this point, and one officer on the very right started smiling. And so I turned to him, and they all have their names on their shirts, and I was just like, hey, so-and-so, obviously you have something you would like to share with us, right? And he opens up his pocket, and he brings out a stack of business cards, and he starts laying them out one by one on the table. And he said, if I'm in this part of the region, I could call, this person every second Tuesday between 4 and 8. Yeah. If I'm in this part of the region, I can go call this person for this particular service or support on this thing. And it was this massive, complex patchwork decision tree exercise that's going on. And he's like, and then he says, he's like, the problem here is like, I'm on this team for a couple of years. I'm going to be switched over to another team. It's all relationship based. I'm going to hand over my stack of cards and the information I have, but then you're going to have to kind of restart this exercise again with the next person. And there's 2 parts to that. One is the continuity of care is not there, or the information sharing is also not there, but also if you can't help someone at that exact time where they're actually willing to do it because you can't compel them, and then you have to go through this chess game to do it with these complex variables with a person with complex needs, you're in a non-winnable situation.
Yeah, the fragmentation definitely doesn't help that whole situation. But I think we're starting to see here in Edmonton, or at least through the police service, we see a bit more of, I'd say it's kind of like been pared down, and we know we've got these couple that we can use at a certain time, and then we have the navigation center now. So that's been nice because we can refer people to like one sole source for help. So I think that's been good.
Yeah, for the folks that are willing to go there. And then when we talk about gaps in services, if you are in prison, federal prison, and you're released, they have a very robust release plan. Whether you're on certain conditions, you're at a halfway house, that's a release from a remand center, nothing. Okay. Release from Edmonton Young Offender Center, nothing, if any. A lot of times we see people that are, whether it's young people just outside the shelter, new Canadians we're seeing more at shelters, hospital emergency rooms, release plans, not much. Because a lot of times you will see, just north of here, you may see someone in a hospital gown walking down the street. So those are the situations where those are gaps in services that we've identified. But those are going to take a lot of time in order to move forward. The navigation center, and I'll just give a quick plug into that one, has been a true game changer in regards to having a best is what we can now, as part of a wraparound services. We know that a lot of people that go to the navigation center, in order to get on certain programs, you need identification. And a lot of times other agencies in the past, you can't, with someone who's been in encampment for a long time, who has severe addiction or mental health issues, you can't point the building out to a person you can get your ID at this address and go 4 blocks this way, 2 blocks that way. It's not going to happen. And that was one of the immediate gaps at the navigation centers, that Service Alberta was not there. Service Alberta got there within a couple of days, and they do identification cards on the spot. That's such a positive, and frankly, they're the only place the people who have gone to the navigation center have their healthcare number on their identification. Unless I go to a navigation center, I can't have that. I got my old paper one. So those are the positive aspects of it, that we're starting to identify those gaps. But it is a process. It's a journey.
So do we see, like you were talking about the uptake, the voluntary uptake, do the people that were trying to get into any programs, do they know those services don't exist on the back end? Is that why they're not jumping into it? Or again, it's like we get to a point where we have to compel people to go and get help. So where's the disconnect in there?
It's very individual. I'll give you an example. Like in one big Canadian city, we were doing a night on transit with the local police service, and they were showing me, individuals, or we were talking to individuals that were sheltering in place in the system, and people of complex needs. There's intersections sometimes between someone who's shelter in place and substance use or mental health, and one of the stories that really stuck out to me is that sometimes people do get access to these services, and something falls through, like you fall back into an addiction, or in one person's case, they have a social network, right? And they really trust the people in their social network, but you can't bring your social network to live with you in those programs. You can't. If you have a partner, that's a complexity. If you have a dog, that's a complexity. If you have things that you want to bring with you, that's complexity.
Is geographic location
that's also a bit of a complexity too,
yeah.
right? So there are certain structures where sometimes people may not be able to align with those structures, and then they kind of end up back into the situation that they're in, right? Due to their own personal circumstances or things that happen structurally with it, or there was a time duration of the program and they couldn't get you to the next step, like that occurs, but it's very individual.
Yeah. You go ahead.
Well, I was just gonna say, like, I get reminded all the time, like, and like a personal anecdote, if you've ever tried to like go get a referral for a specialist from your doctor, and you have to like make an appointment for your doctor, and then you have to get the referral, and you have to make sure it's the right referral, because if it's, you have to, otherwise you have to go back, and it's another few weeks. And like, I think I bring that up because like I've been through that process recently, and it's like you like, I have food, shelter, I don't worry about transportation, and yet that experience can make you feel so like disempowered, and this is like me, this is like someone who understands the system, and I had a full night's sleep supposedly. But like, so if you as a governor, as a decision maker, you project yourself into that space, and I think all of us, not just at this table, but like we also have a certain amount of entitlement in that, like, no, I have a right to access the system, and I should be treated well. But as I think, and maybe like you start to strip that in, and I use entitlement in like a positive way, like you are entitled to us, like to be treated with respect, that those basic things. But when you start to strip that away from someone, then they get so, my observation is like, when you're in core need of either housing or food or a job, those types of things, and you have not felt that entitlement to the system, it like people kind of like they hit us what we would perceive as a minor roadblock, even as much as like not being able to find a place, and they kind of give up because the system's never worked for them. Why would it start working for them today? Like, is that a correct assumption?
Exactly, and to echo Sarah's, in regards to the city, we're a regional hub of so many. Everybody comes to Edmonton, and there's a lot of folks here that not only come and work and play, but they're also here to access services as well. So it is a strong financial challenge on everyone, whether it's on city administration, city resources, but also social agencies, emergency services as well.
I just want to bridge off of something. It might be a bit of a tangent, but I think it's actually quite important. So one of the things, and I will never forget this for the rest of my career, is that families have played a role to play on this. I'll give you an example. We were in Philadelphia, and Philadelphia has the most comprehensive outreach approach for transit, but the approach is very different, and it's very uncomfortable in the sense of like they will offer you support services first, and if you don't, then it goes to enforcement. And one of the things that I thought was very eye-opening is we were out with the police one night, and there was two gentlemen sitting on the subway platform. And the rule is that you offer services first, and if you don't go, you're asked to leave, and it goes from there. And they were sitting there for an hour. And we were at the station. It was a high-use station for the topic area that we're studying. And I said to the officer, I'm not asking because I want you to like kick them out, but one person looked like they came from work. The other person looked quite weathered. And I said, I've noticed that, you guys do an enforcement approach, people don't leave, which usually a police officer comes and says, can you please leave? And people will typically leave the station. And I said, you haven't asked them. And they've been here for an hour. And I'm like, I'm not wanting you to kick them out. I'm kind of curious. And I said, why haven't you engaged them? And he said, they're brothers, and they come here once a week. His older brother comes here and he checks on his brother, and they sit and they watch trains. They don't say too much to each other. And he's like, families come here. They come here to try to connect people to social services. They come here to give their siblings, their family members, like, something to eat, to check on them, to see how they're doing, to try to convince them to come home, to plead with them to come home. And at times, they will just come to visit. And it was one of the most powerful things I've ever seen, where it's like there's the role of everyone here in this conversation, but also that's part of the conversation that you don't typically see. And I was so happy I got to see that. Yeah. And they're there once a week, and they were there pretty much all night.
I've said that on a number of other podcasts, like police and a lot of these services are kind of at the end of a whole bunch of processes that have failed a person. So, and that's right from birth, right? Family, education, the health system. You've had a lot of things go wrong to find yourself in a certain situation. And then now we're dealing with you for whatever it might be, mental health, drug use, all those things. We're kind of on a good trajectory here with solutions and just talking about other cities. So I just want to kind of stay on that if we can, and just focus on what it looks like when we're working with these other cities. Are we talking to them a lot? Are we coming up with, okay, I think solution A might work, and you have solution B. We'll go do it for 6 months each, and we'll come back and we'll see if it's working. And if yours isn't, okay, we scrap that. Like, is that level of collaboration going on?
I'm glad you mentioned it, because it starts to feel really isolating as a city, like you're the only ones dealing with this issue specifically. And I think maybe it sometimes feels that way for the frontline workers as well. Like, things can't possibly be worse elsewhere.
Everyone always thinks their problem is the worst problem.
And it's unique to us. But I think coming out of the pandemic, everyone, once they kind of like took a breath, they looked around and they saw that it was like substance use was up. Severity of the use was up. Severity of incidents on transit was kind of spiked for a while. And something we haven't sort of disaggregated is there's the perception, there's the social disorder, and then there's the violent crime, and that all that's one, like as a governor, that's one big jumble, right? And you can pull it out and you can say, well, it's this much or that much, but at the end of the day, the transit user only sees the jumble of issues, and so I think our both police, I think our enforcement officers, municipal enforcement officers, and even governors. Like, I know lots of my colleagues on council have gone to transit conferences at the national level. Like, public safety is a national issue. And right now I think we're very focused on a international issue, international economic issue, but I think public safety is still a national top 3-ish, like it's in the top 3, because people are feeling it. That, I shouldn't say that gives any kind of comfort, but seeing that from Vancouver to Fredericton, like those are things that Canadians in cities of all sizes are identifying as their number one issue, says something here kind of fractured in the last 5 years, and we're all trying to figure out how to put it back together. And
because currently right now, I believe we're in the era of the perception of safety. It's purely about, we don't see you enough. Okay. And I don't feel safe in certain areas. We can spout off all reduction in crime severity stats, calls for service stats, all you want, but that doesn't matter. What matters is how people feel. And people have the right to feel safe in public spaces. And then how do we work towards that? And we're under the same thing. It's not, it doesn't wash with a member of the public or a member of the business community saying, hey, give us more people. It doesn't work that way. We're an expensive service. But how do I utilize the data, in partnership also too with our city peace officers? How do we utilize the data to ensure that we are in the right places at the right times? Now there's certain things I want to do 2 things. I want my people to be in the right places at the right times where our spike in crimes are occurring. but I also want them to also be in the right places at the right times when there's many people utilizing the transit services so they can see the peace officers and the police officers doing their work during the day.
So there's a component there of like policing smarter, not harder. But I think I also hear like the solution isn't always just more boots on the ground. Like we have to be in the right place at the right time. How do we do that? How do we allocate resources? Something to that effect?
Yeah, and I know we'll get into a little bit about our partnerships with the city transit peace officers and the transit community action teams, but we're utilizing, we'd love to have our data, all of our data combined. North America wide is that all police agencies, they're trying to be data driven. We've come a long way in Edmonton because we do know that we can't keep increasing to have we always know that we do need more officers, but we have what we have. And how do we utilize data so we effectively and efficiently deploy those members? We're not in certain situations like there are in some US cities where they're hundreds short. Right now we currently have 10% of our sworn staff currently off. But that's not uncommon compared to other cities across North America as well. But again, how do we deploy them utilizing the data? So we do utilize the city data in order to deploy our members at high volume times, and then we utilize our data when we partner up with transit peace officers when we want to address those evening issues at certain stations in the city.
Yeah, certainly when you hear some of the conversations out there and people will say, well, if you just change this one thing, or if we put this one person over here, I want to say it kind of cheapens the discussion. It doesn't lend to the complexity that actually is there, because just changing one thing, it's not so linear. We can't just say, I change this one thing and it will result in this. If I change this one thing, it might affect two other things, and then that all has an impact on the end destination and where we're trying to get, right, which is just creating public safety. One of the things I was going to ask with this is, when we're talking about those shared solutions, so what cities do we work with a lot? Like you've done the tour of pretty much all of Canada. You've seen it right across the nation, now into the US. But what cities are we seeing that are comparable, or is everybody just at this level of, I don't want to say crisis, but
I think I really don't like comparing, one city's issues to another city's issues, because it kind of turns into like a bit of a bad game in a way.
You can say we're better in Calgary, though.
I am an Oilers fan, but I think what I would say is that like the information sharing has been huge across Canada and the US. And I'll give an example. Like the 7 largest agencies in Canada got together, created a national task force. We came up with 27 pretty extensive recommendations on things such as mental health, housing and supports, customer safety, staff safety, and we've been pretty successful in securing additional funding and expertise and resources. The agencies share information, ideas with each other. There was some excellent work that was coming out of Toronto when it came to having multidisciplinary tables and getting more support services it's almost like you build the tree trunk with the branches, and Calgary took some of that was relevant for them, plus their data program, or how they started assessing and integrating data to help build out part of their program. So we've seen successes in that sense. We've seen expansions of a co-responder, multidisciplinary outreach teams, and Edmonton was actually one of the first ones on that one. So we've seen that, but has anyone fully figured this out? No. We've had some really good initiatives in some cities. We've had some ones that have had to be retooled and recalibrated, and that's fine because the context is different. Some cities may have more complexity with mental health. Some cities may have more complexity with opioids. But at the end of the day, everyone's trying to help each other out. Like we all, to Sarah's point, and you've mentioned this too, working across the continent with your colleagues, is that we're all trying to help each other out to figure this out. Mm-hmm. And there's things that I've seen that's really good from, I'll give an example. A couple of police services here in Canada have done a lot of work on figuring out who's the high system users for people who are actually preying on vulnerable people in transit, and focusing their efforts on dealing with that, the criminal matters associated with that. That's been quite helpful. There's been some cities I've seen in the States that have very comprehensive homeless management information systems out there, HMIS systems, that are trying to trace and at least create some form of case management so that people can understand the interactions and how to help people out. But have we figured this out? No, it's going to be evolving. And that's just the way it is. The other issue that we're having, and I think is a pretty rich conversation, and Keith's hinted at this as part of his discussion, is that we've done a lot of things to add more staff to the system, add our new partnerships. Perception's a challenge. What people perceive on their own individual trips, and if they see something that discomforts them, or they see an incident that they were a victim of, or had an incident they were a victim of, that will forever change how you view something. And we've had some really tragic incidents on transit. We've had some really incidents that changed the lives of people who were the victims of it, changed the lives of the people who work in the system. Yeah. And we have to be very deliberate and thoughtful in our approaches on that, because at the end of the day, perception issues do persist even when we're trying to do all these components. But at the same time, we need to find ways to address that, but not minimize people's individual experiences and things that may have happened to them as well.
Okay, so those are good points. One thing I want to make sure we get onto as well is some of the solutions. So when you're surveying the landscape of things that are going on, what would you, or where are we at right now? And then also, what would you like to see in the future? So whoever would like to start.
Okay, I'll start. So we're in a chicken and egg situation. I think when we talk about the long-term solutions, I'll say to perceptions of safety, it comes with natural surveillance. And when you're talking about, in Edmonton, a lot of our transit is it's concentrated around the downtown. We know we need more people living in the core. And using our transit, our transit system is on a hub and spoke model. And so we know that more people living in the core will probably help the perception of safety. That's always kind of funny to me, because people think, and I grew up in the suburbs, that, you all of a sudden have people walking down your street, but, by and large, in a dense, big city, having people out walking their dog at all hours, having people coming home.
There's just more eyes out there.
More eyes on the street, and people are more reluctant to do things or to cause trouble if they know that there's going to be a lot of traffic, like pedestrian traffic or even vehicle traffic. But I think we have to, it's a chicken and egg situation for us, because to get people living downtown and to get people to make that jump into living in a denser, more transit served area, they have to feel like the trade-off is going to be worth it. And for a lot of people, the perception of safety is a trade-off that they're not willing to make. So we're really grappling with how do we invest resources with the limited resources we have? And we haven't talked a lot about the money question, but for this council here, and I think for a lot of councils across Canada, we don't have infinite buckets of money to pull from, and policing is really expensive. And that's not a criticism. That's a reflection of having someone who's a specialist in public safety and has those authorities. So. I think part of it is creating conditions by which we can start to just get life back into our core, the core of our cities across Canada. And just as I think the pandemic kind of accelerated something we were seeing already and we're pulling out of it, once we get moving once we get some momentum in terms of that perception of safety, then I think we'll build the public trust and confidence in making those decisions again. For me, a really big challenge has been that people, and I'm glad to hear you say, you can't argue with people's feelings on this, because I think that one of the secondary harms leaders across North America have done is dismissed people's feelings about things, especially when it comes to safety or social insecurity. And I think that what we need to do is kind of validate that and then say, what we're doing about it. And one of, I think, our collective mistakes as leaders has been when someone says, I don't feel safe on your transit system, we push a number back at them and say, well, there's only 1% of transit riders or transit rides experience an incident. But that's 1% is a lot.
And stats can only speak to so much.
Yeah.
There's a lot to be said for actually showing them.
Exactly.
Like actually going out and showing people stuff.
Yeah, and
Giving them an
people need to
example.
feel it, and they do. And I think the point the superintendent and David made, that like if you have a negative interaction, that is like humans are still animals, right? So we can have 100 great interactions, but the one that doesn't go well, and I think of one personally that happened to me when I was 19 years old, which is unfortunately a very long time ago, but that sticks out in my head. When I think of the times I haven't felt safe, I go 20 or more years back. And I think practitioners kind of get it. I don't think we've figured out a methodology as governors or as safety sort of at that level to address the trauma that comes from being in a public space when something goes wrong.
Okay.
And that, I think, is the sticky part for us in terms of getting to solutions on this.
And maybe Superintendent can speak a bit to some of the stuff that the police are doing, because with the transit peace officers and solutions.
And a lot of times it was some of these major incidents that occurred, in the Corps that, caused a reaction to increased resources. Because remember, it'll be, I guess, 3 years in May when there was the homicide of the two members of the Chinese community that occurred. That the positive, no, there's nothing positive out of that, but the reaction in order to increase resources in that core, in the shelter district, that's number one. Number two, that we had a spike in number of violent incidents in transit areas. So where the city stood up the 32 positions for a 2-year period, where we were able to really get a handle on the lot of disorder and the violent crime that was occurring in that particular area. That was one thing. And then with the government of Alberta funding upwards to 50 positions for the transit, for our transit community safety teams. Now, since then, at the end of February, the Minister of Public Safety did announce, whether this has a little bit of something to do with the politics, the economic politics that are occurring right now, but did direct that all municipal and county peace officers will collaborate and work together with the police of jurisdiction. Now, currently, right now, the biggest bang for the buck that I saw for us to really create an impact is with the city's transit peace officers and their transit community action teams, which are very similar to a beat officer, only on transit. But because they have 100, a little over 100, and congratulations to Council on funding another 30 that I just read yesterday. But we found that by doing a joint coordinated structured deployment model, it's created a bit of a benefit, utilizing the data, placing them in certain locations. And what we found is that we have 30, I counted 30 actually LRT stations, and then along with probably another 12 or 15, I forget how many transit centers we have. While I have currently 38 transit community safety team members, and when you divide these shifts and everything. But yesterday I was on a parade and there was approximately 30 police officers and peace officers there. Perfect. The non-smart thing to do is put one person at each station, because again, that doesn't solve any issues. But what we did was we utilized our data and we placed them, the groups where they are in, say, no more than 3 stations for a condensed period of time. So we use the term a forced deployment model, meaning even though you have not many people, officers there, it appears you have many more. Because you go to other major cities around the world, London Met is a gold standard in regards to they don't have that many police officers working during the day, but it sure looks like it. And then when you see how they deploy them, there's that one piece. And what we found is that we're having very good success. One of the challenges we have in regards to the peace officers and the police officers, a lot of times it's sharing of the information and the barriers that both sides actually put up. So whether whether it's getting the proper information intelligence from the Transit Operations Center, and where it's us not allowing any access to some of our computer systems and our CPIC, our Canadian Police Information
back to
Center.
sharing info
It all goes back to that. So myself and my equivalent at the city is we're working together as a number one, how do we break down the barriers to share more information? But in the meantime, while we're working through that piece, we have a transit peace officer and a police officer working side by side. So when an incident occurs at one LRT station, whether it's a criminal incident, a potential violent incident, immediately that information, the photograph, the time, potentially video, shows up on that transit peace officer's cell phone. We're already deploying at another station. We've had some excellent successes the last 3 weeks, and we see that as only as being beneficial. I do want the transit peace officers to get some access to our Canadian Police Information System right now, because they can't, I want them to have the ability to arrest somebody on a warrant and release them on a piece of paper, but right now we can't do that. Whereas they have to call us to come and take over that, and all that does is more time.
Yeah.
And again, the whole purpose of us working together is to be visible and being proactive. And so we're working through it, and I'm confident that we will have good successes. It's not about I want control or I don't want to give up control. It's like we're so far past that. Is that again? We talk about the partnerships and working together, and we see that as a springboard. I see more opportunities working with my city partner, with the with the community peace officers work on Churchill Square. Yeah. With our beats in front of the library. I see opportunity with the municipal enforcement officers on business licensing. I would like to pivot some of my people from dealing with licensed establishments. I want to have them start dealing with the convenience stores in the inner city that are selling illegal weapons and contraband and drugs. So we just see this as momentum, is kind of what was stated earlier, is let's grab a hold of the momentum and keep moving forward.
Okay. And I want to make sure we highlight also your study that's coming. So I'll give you the last word here because we got about a minute left. Can you tell us, like, when is your study from the 5 cities coming out, and how people could even find that?
Yeah, so there's a study through the Transit Cooperative Research Program that's going to come out later this spring, looking at the 5 different cities on that particular topic area on the impact of substance use on transit. But one of the things, just to close this out, is that we're seeing the numbers come down. We're seeing some good work that's being done through partnerships, that's being done through agencies, really lasering into addressing this particular issue. But the one thing that we need to stop, and this is happening on both sides of the border, is that agencies are now at the point where they're talking about these social complexities. They were very uncomfortable to talk about substance use and mental health and individual sheltering on the system. And now they're saying, okay, here's the support that we need. And there's this really bad political habit, and sometimes it's psychological, where one level of government say like, well, what are you doing? And then the other one's like, well, you need to help us. And they start doing this. Yeah. And that is happening in several jurisdictions. Sometimes it's the cities with the province. Sometimes it's the federal government with the cities and the states right now. And that is not helping anybody. It's not helping the public feel safer. It's not helping the frontline staff that are trying to run a transit system. It's not helping people who are trying to navigate the system for their everyday needs. And it creates a lot of frustration and subpar outcomes. And that's something that we need to stop.
Yeah, I agree. I guess that's a good place to wrap it up. And I want to say thanks for coming in today. I think you flew in from Toronto for this, or?
I'm here all the time.
Yeah.
So, I'm from here. So,
thank you for being on here. And we'll have to do another one and get some updates in the future about where things are at and how things are working. So that's a wrap for us on the second episode with The Quiet Professional and Edmonton Police Service. Thank you. Real conversations and some hard truths. Welcome to The Quiet Professional.